So hello pharma guys, welcome to my channel Easy Learn Pharma. So today I am going to discuss about a new part, that is the parts of prescription. Okay. So what do you mean by parts of prescription? Last class I had discussed that before prescribing the medicine, the physician asked the patient what is your name, what is your age, what is your sex and what is your address. Then after that again the physician asked the patient which type of symptoms occurs in your body, because according to the symptoms the physician prescribe the medicine to the patient. Okay, so all the information regarding the patient and all the information regarding the medicine, that all the information written in a specific format, and that specific part again segmented in the different parts of prescription. The first part is date, second part is name, age, sex and address of the patient, next part is superscription, next part is inscription, next part is subscription, next part is signatura, next part is renewal information, next part is signature of the RMP, registered medical practitioner. So one by one I'll be discussed. Okay, so first one is date. Okay, so what is the importance of the date in the prescription? Why before prescribing the medicine a physician must be written the date in the prescription format? So what is the importance of the date? If there is no date in the prescription, so which type of problems will be arised? Okay, there's so many problems will be arising. The first one is date. Okay, simply you can say it helps a pharmacist to find out the date of prescribing. That means in which date the prescription or in which date such type of medicine has been prescribed. Ajiro date re prescribe heichi na 2 to 3 days before heichi. That means co date re prescription day prescribe heichi. That's why a pharmacist easily know, or that's why a pharmacist easily find out whether the course is completed or not. तो माने जहाँ भी मेडिसिन से पेशेंट को दिया जाइए तार कोर्स कंप्लीट हेलानी ना हेनी. If the course is completed, then whether it is renewal or whether it is refill or not. तो माने से फार्मासिस्ट जन जल्दी कोर्स कंप्लीट हो जाइए तो से कोर्स को से अगेन रिफिल करिवो ना नाही. So simply you can say the date, it helps a pharmacist to find out the date of prescribing and refill the prescription. Clear? And again which type of problems will be arise? How con problem arise हुआ? Again I am giving one example so that you can easily understand what I am telling regarding the importance of date. Okay, suppose a physician prescribe the medicine to a patient for 8 days. Okay, suppose a physician prescribe the medicine to the patient for 8 days and you have to administer two times a day. Okay, so physician कहिछि ए मेडिसिन तमे 8 दिन पे खाइबो, पर डे तमे 2 टैबलेट नबो. That means 8 days हेले तो 16 tablet you have to administered in the complete course. Okay, but in that time the pharmacist dispense to the patient 20 tablets. Okay, so in that time pharmacist what will happen? Na pharmacist kon karichi na pharmacist dispense 20 tablet to the patient, but a patient administer 16 tablet, but the pharmacist dispense 20 tablet to the patient. Okay, and there is no date will be mentioned. So the date is mentioned here. So how a patient easily know in which how a patient easily find out in which date my course is completed, को date रे मो course complete हबो. तो से कौन करियो patient ना से 20 टा tablet खाई चलियो, because तार केतरा पड़ जाइछि ना you have to administer 8 days. 8 दिन पे तमे तमरो कोर्स अछि, बट से कौन करिछि ना 20 tablet से नहीं जाइछि जगह रे. So definitely in that time you can say that is the misuse of the drugs. So what is the importance of drug? Sorry, what is the importance of the date? Now another importance of the date, it will prevent the misuse of narcotic or other habit forming drugs. Clear? So first point is it helps a pharmacist to find out the date of prescribing or to find out the date of prescribing and refill the prescription. And second thing, it prevents the misuse of the drugs and other habit forming drugs, or it may be narcotic drugs. Clear? What is the importance of the date? Next one is the name, age, sex and address of the patient. So why The name, age, sex, and address of the patient must be written in a prescription. What is the importance of that? Simply name and address of the patient. First, I mean name and address of the patient, because it serves to identify of the patient, because it serves to identify the prescription. तामाने ए नेम और एड्रेस हम इजीली जानी परिबा कि व्हिच टाइप और व्हिच प्रेस्क्रिप्शन फॉर व्हिच पर्सन ए प्रेस्क्रिप्शन टी कहार, दैट मींस इट इज इजीली सर्व्स टू आइडेंटिफाई द प्रेस्क्रिप्शन. एंड सेकंड थिंग, एड्रेस ऑफ द पेशेंट. ये जो एड्रेस पार्ट आसे कहीं के आसे ना, बिकॉज मेडिकल रे कोन ना, मेडिकल के सर्वे करा जाए, ते सर्वे रो से माने जानि परंती कि को एरिया रे को टाइप रो पेशेंट बेसी अछंती. तो ए एड्रेस थ्रू a physician easily clarified, easily know which type of disease will be arise in that particular patient. Okay, so it helps to easily diagnose and it helps to easily prescribe the medicine by the physician. The physician देखला कि ए एरिया रू maximum diabetes patient अछंती, तो या केस रे बोध diabetes थाई पारे, तो सेही जगह रे से easily diagnose करि पारला and easily medicine मध्यम prescribe करि पारला according to the address of the patient. Clear? And second one is age and sex. Age of sex जो part असला, and first the age part. The age part is completely depends upon the calculation of the dose. That means according to the age, a physician according to the age a physician calculate the dose. That means जदि सेही जगह रे गोटे children अछि तार age 8 to 10 years, तो physician देखला कि children अच्छी, it is very difficult to swallow the tablets, so in that time the physician prescribe some syrups or some liquid dosage forms. Okay, that means जदि इस जगह रे ये adult अच्छी जार age 20 to 30 years, then in that time the physician prescribe the tablet to the particular patients. Okay, so and another thing, जदि variation आसे जल्दी हमें कहूचे कि 15 to 20 years and 25 to 30 years. ए केस रे कौन करे ना, ए केस रे the physician prescribe the small dose or small amount of dose to 15 to 20 years old and higher amount of dose to 25 to 30 years old. As for example, for 15 to 20 years old, paracetamol 500 mg prescribed by the physician, and 25 to 30 or 20 or 21 to 30 years paracetamol 650 mg prescribed by the physician. And that information or that dose calculation is possible by the age. That means age is completely depends upon the calculation of the dose. That means how much amount of dose prescribed to the particular patient according to the age. Clear? Name, age, sex, and address of the patient. Next one is the superscription. So, what do you mean by superscription, or what is the importance of the superscription in the prescription? Superscription, it is completely depends upon the Rx symbol. The superscription is completely depends upon the Rx symbol. Okay, which symbol? Rx symbol. Clear? So, all of you mark, तमे समस्त mark करिथिबो कि before prescribing the medicine, the physician first write Rx symbol. Rx symbol लिखी सरी तापरे से medicine लिखवा start करे. So what is the importance of the Rx symbol? The Rx symbol under the superscription. So what is the importance of the Rx symbol? Now it is the Latin words, that's a Latin words, that's meaning is take down. Okay, what? Take down or you take, or you take. What is the mean? What is the Rx is the Latin terms, or what is the meaning in the Latin words? Like take thou or you take. So what is the meaning of the Rx? That means why the physician before prescribing the medicine must be written the Rx symbol. What is the meaning? Simply हमें जानिले कि Latin term यार meaning होगी take thou or you take, but simply यार meaning English रे कौन रहुचे? In that time before prescribing the medicine, the physician must be written the Rx symbol. That means before prescribing the medicine, the physician prayer to Jupiter or God of healing for quickly recovery of the patient. तो माने सही जगह रे फिजिशियन टी भगवान को प्रार्थना करे केमती पेशेंट टी क्विकली रिकवरी हो जाओ. So that is the particular meaning of the RX. Clear? Simply you can say the RX is the Latin word that means take thou or you take. That means that particular meaning if the physician prayer to Jupiter or God of healing for quickly recovery of the patients. Clear? And next one is the inscription. So what is the inscription? Okay, or what do you mean by inscription, or what is the importance of the inscription in the prescription? Okay, so inscription, that is the main body part of the prescription. Prescription ro main body part जोटा को हम कहूँ that is the inscription part. तो सेटा कौन ना हमार prescription रे main body part कोटा ना name of the medicine and their proper quantities. Okay, name of the medicine and the proper quantities. This part is called known as inscription part. So that's why you can say the inscription is the main body part of the prescription. Our prescription main body part कोटा and जो जगह रे medicine name अच्छी and their proper quantities अच्छी, and all the medicines and with their proper quantities mentioned or written in a separate line, and it should be written in a English language. So what a physician rule होगी से कौन करी वरना name of the medicine and the proper quantities written in a English language and in a separate or specific line. Okay, that's why a pharmacist easily know or easily find out. Clear? Next, subscription. So what do you mean by subscription, or what is the importance of the subscription in the prescription part? Okay, the subscription part, this subscription part is completely direction to the subscription part also, the subscription part is completely direction to the pharmacist. That means the subscription direction to the pharmacist. That means in subscription, which type of information or those information present in the subscription part, that information completely or that information directly instructed to the pharmacist. Say information सब कहाँ को instructed अच्छी ना pharmacist को अच्छी. Why? Now because the pharmacist preparing the medicines and dispense the medicine to the particular patient. That okay? That means in the prescription part, in which part some informations are present, and that information completely instructed to the pharmacist. So which type of information? Now for preparing and dispense to the patient. Okay, that means how to prepare and how to dispense, or which type of medicine dispense for the particular patient. Clear? So that is the subscription part. Simply you can say the subscription part is completely instructed to the pharmacist for preparing and dispensing the medicine to the particular patient. Clear? Next one is the sig or signatura. You sig or signatura, that what is the meaning of sig or signatura? Sig, that is the Latin term of signatura. Signatura ro Latin term or Latin word hochi kana na sig. It will be labeled. Okay, it is labeled sig. Okay, so this in this part, those information are present in this part that is completely instructed to the patient. That means a signature re jaha bhi kichhi information achi, that information completely instructed to the patient. Say information kaha ko instruct kara jaichi na patient ko instruct kara jaichi. So which type of information present in the sig or signatura? Now first one is the name of the which type of okay, so which type of information present in the sig or signatura? Now first one is quantity to be taken. That means how much amount of dose or how much amount of drugs you have to administer. That is that information present in the Signatura part, quantity to be taken or how much amount of dose or how much amount of drugs. Okay, and second one is route of administration. Route of administration. That means in which route you have to administer such type of drugs. And another one is timing of administration. Okay, so such type of information having in the signatura. A signatura part such type of information are there. So what are there? The quantity to be taken. That means how much amount of drugs you have to administer or how much dose you have to administer. And second one is route of administration. And such type of drugs in which route you have to administer to the particular patient. Okay, in which route you have to administer. Then timing of administration. That means in which time you have to administer. That means duration of administration. Suppose you have to administer daytime or morning, afternoon and night. So that is the timing of administration or duration of dose. Okay, so that is the information having in the signatura. Next one is the renewal information. So what do you mean by renewal information? In the renewal information, completely mentioned ki whether it is refill or not. Okay, or in which time it will be refilled. A renewal information clearly mentioned na co time again you have to refill the such type of medicines. Okay, that means this information is completely described whether it is refill or in which time such type of medicine again you have to refill. Then signature of the RMP, signature of registered medical practitioner. Okay, after prescribing the medicine, the physician must be signed in the lower part of the prescription and with their proper registration number. So what is the importance? Why the physician after prescribing the medicine, why the physician sign? Kahin se sign karuchi? What is the reason behind this? In case of the kichhi bhi problem arise hochi, then you can find out the which type of then you can find out which physician prescribe the medicine such type of medicines for such type of patient. Okay, so the kichhi bhi problem arise hochi, you can easily find out which type of doctor or which doctor prescribe the such type of medicines. Clear? So these are the parts of prescription. So again I am repeating. So first one is the date, name, age, sex and address of the patient. Next one is the superscription. That superscription is completely that superscription it is symbol the RX. Then inscription, it is the main body part of the prescription. Then subscription, it is instructed to the pharmacist for preparing and dispense the medicine to the particular patient. Signatura, that information instructed to the patient. That means quantity to be taken, route of administration and timing of administration. Renewal information, whether it is refill or not, if it will be refill or if it will be continue or in which time you have to refill. Then signature of the registered medical practitioner. After prescribing the medicine or after written the medicines in the prescription, lastly in the lower part the physician must be signed and with their proper registration number. Clear? So thanks to all.